Welcome to Never Too Late for Fitness Radio, bringing baby boomers proven strategies and innovative products for getting fit, staying fit, so you can live a longer, healthier, and happier life. Here's your host, best-selling author and fitness advocate, Phil Ferris.
This is Phil Ferris, and welcome to our show. Never Too Late for Fitness Radio provides answers and straight talk about fitness, nutrition, and healthy lifestyles for people over 50. Our goal is to educate and advocate health and fitness strategies that help you live a longer, healthier, and happier life. If you or a loved one is suffering from dementia or Alzheimer's, this show is for you. If you are looking for proven strategies for preventing and reversing the effects of brain disease, this show is for you. If you finally want to understand the causes and risk factors of brain diseases and have a plan to address it, this show is for you. My guest today is Dr. Kelly Miller, founder of Health Restoration, located in Temple Terrace, Florida, and 2 locations in Kansas City, Missouri. Dr. Miller's clinical practice covers over 38 years, treating over 15,000 patients. He is an international lecturer on the genetic, nutritional, and hormonal considerations related to heart health. Dr. Miller's educational background in acupuncture, chiropractic, naturopathy, functional diagnostic medicine, aging, and regenerative medicine allow for a multifaceted analysis and insight into the body's anatomy, physiology, and biochemistry to help patients restore their lost health or develop a strategy for functional longevity. His understanding of how to combine these disciplines produces outstanding outcomes for his patients. Dr. Miller is the author of 7 health-related books. His most recent book, Saving Your Brain, Causes, Prevention, and Reversal of Dementia, Alzheimer's, recently achieved bestseller status on Amazon.com. The 7-book series is called Health Restoration and is edited by George Ann Gregory, B.S., M.S., Ph.D. The first 3 books, 13 Secrets to Optimal Aging, How Your Hormones Can Help You Achieve a Better Quality of Life and Longevity, and Micronutrient Testing, How to Find Out What Vitamins, Minerals, and Antioxidants You Need, and Is Your Environment Stressing You Out? How to Proactively Protect Yourself from Environmental Toxins, are now available on Amazon.com and on Kindle. So thank you so much for being on the show, Dr. Miller.
Thank you, Phil, for having me. I'm looking forward to this. I'm really excited about this book.
Okay, great. Well, you have a practices in Missouri and Florida. Can you describe or tell us a little bit about the practice and the type of people that you help?
Sure. What we've kind of moved to through the years is we're now using a brain-based protocol for treating people. You know, if we kind of look at so many different illnesses in today's society are related to brain dysfunction. At the beginning of life, we have ADHD. You have 1 in 7 boys now have ADHD. We have 1 in 68 children have autism spectrum. We have post-traumatic stress disorder. We have a lot of problem with the veterans coming over from that. We have traumatic brain injury. It's very significant for our veterans and people with sports injury as we become more aware. And we have 50 million Americans have anxiety, have been diagnosed with anxiety disorders. 60 million Americans have insomnia. And we have Alzheimer's is the fastest growing cause of death now in the United States. So we have a lot of problems with our brains these days.
Okay. And your newest book focuses on dementia and Alzheimer's. What motivated you to address this specific health challenge?
Well, many selfish reasons. As we talked before, we both played rugby. I played for 21 years and had multiple, injuries to my head, facial lacerations, head lacerations, and I've also been in a couple of car crashes. So, what I started noticing, I'm 62 now, is probably in the last 5 years, I just really noticed, my brain wasn't functioning, my recall, the memory of different events, especially people's names. I used to, be a movie buff, and I could tell when, the scenery, the name of the movie, the actors, and I was just kind of grasping at that. So I started looking for solutions for myself, and I had my first EEG in 2016, which confirmed that I had, some areas of the brain that had been injured. So I started a quest to fix my brain. So along the way, we're able to help a lot of other people's brains as well.
Okay. So in your research, in your studies, have you, maybe you can share some of what are the causes of dementia and Alzheimer's?
Yeah, there are many. One of the challenges with Alzheimer's, in using a drug therapy is that drugs, viewers may not realize that, but drugs work by inhibiting or stimulating a single pathway. And the challenge with Alzheimer's is that there are multiple pathways that will create this problem. So you're limited by the drug, and so you might have 6 different pathways. Well, those 6 different drugs would create so many side effects. So it's very challenging. The biggies on this are some people have called Alzheimer's as type 3 diabetes. Blood sugar regulation is a very major player in this, and because it creates inflammation, it creates problems in the blood vessels itself. It creates something called advanced glycation end products, which are damaging to tissue. So that's a big deal. And we have a lot of people with blood sugar dysregulation, a lot of type 2 diabetes, a lot of metabolic syndrome, and the other is cardiovascular disease. So we have decreased problems with hypertension, or we're getting plaquing in the arteries, or we're having peripheral arterial problems. We have a decreased circulation to the brain, so that when the cardiovascular system isn't working right, we're not getting blood flow to the brain. So the blood flow is not taking oxygen. It's not taking those micronutrients that we need. It's not taking everything else that we need, the oxygen, the micronutrients, the things that we need for mitochondrial energy. So all those things are down. And the other thing is there is some genetic variances, which does not necessarily, I want to emphasize, just because you have these genetic variances does not mean you're going to get Alzheimer's, but it means you have a weak link in your system, which you need to identify, you need to shore it up. One of the big ones is something called ApoE4. So ApoE is a type of LDL. So, we have the HDL, which is considered the good cholesterol. There's actually 5 different kinds. And we have 7 different kinds of LDLs. But what the ApoE does, one of the things this function does is it takes this substance called beta out of the brain. And it's the accumulation of this beta in the brain is one of the things that we see in the Alzheimer's patients. So if you have this ApoE4 gene, you're just not as efficient at cleaning out the beta, okay? But that can be compensated for by exercise, by taking niacin, by getting your blood sugars in there. But if you don't know, if you have this ApoE4, then you don't know you need to take more niacin or do some of these other precautions.
Okay. Now, Dr. Miller, losing your mental capacity is one of the biggest fears that people over 50 have. We fear it, but we really don't understand it. What are some of the biggest misconceptions people may have about the diseases of the brain?
Well, I think the number one, the takeaway from that is that a lot of people think there isn't anything to do. Okay, so if one thing we want to get your listeners on, there are definitely action steps to take for all different kinds of brain problems. There are many non-drug therapies for it. And so the other thing is, I guess, about the Alzheimer's and generally some of the misconceptions is that people with a higher education have reduced risk. That's one thing I've seen out there. Some patients, if we have time, we talk about, as an author herself. A lot of people say if you can remember past events, then you don't necessarily have a problem. That's not necessarily true. It only affects the very elderly. We find that people had Alzheimer's probably for 15 years before they're clinically diagnosed. So it's something that starts, at a younger age. And I think those are some of the major ones that I seem to run across.
Now, you mentioned that, it's something that you don't identify right away. And, are there early indicators that we can observe ourselves or others that can signal that it's time to act now?
Yeah, I think most of us know, like I am here, I don't know, I don't necessarily have Alzheimer's, but I inherently knew that my brain was not working right. There was something wrong. It was not like me not to be able to recall these things. So I think people have a sense that something's on, but lots of times it's on and off. So it's not consistent. It's not till it gets consistently that, they often get it checked out. So along with when the brain's not working right, lots of times I would say a lack of emotionality or too much emotionality, like a change in their loss of joy. When the brain starts failing, elderly people will get a little more depressed, and when the left brain starts failing, so anxiety, depression, a lot more sleep disruption, change in behavior, just brain fog, a little slight change in personality. So sometimes it's picked up by, our spouse or a close friend or something else. But I think really the way we're seeing this, at this point, I recommend people start getting baseline testing at age 50. They should start looking at, we have some nice online testing they can do, and try to get a handle on where they're at, and then get a score, and then we can work on improving that score.
So you mentioned getting a baseline test online. Where would they go to find this out?
Well, we've got one, and what we can do for your listeners, we have it's called Brainspan. It's a nice test. It's online. It probably takes 10 or 15 minutes, and it checks memory, processing speed. It checks lots of other things. It's coupled with a fatty acid test for omega-3s, so they can do a little blood spot test at home and check their fatty acids, because fatty acids, just having the right kind of fat in their brain, our brain is 80% fat by dry weight, so most of us are deficient in omega-3. So we can get that status. That's one of the things we can build that up. It'll also give us a score, so we can make suggestions, recommendations, and then we can redo this online test so we can see that the score is getting better.
And that's something they would find on your website?
Yeah, so what we'll do normally, that's $199, and so like we'll do a special for your listeners. They can go on my website and register their name, mention the show, and we'll send them a kit for $119.
Great. Well, I appreciate that. Another question that comes up is, if someone already has Alzheimer's or dementia, is there hope, and are there options? Because I have some friends that have just kind of resigned themselves that they're on a slippery slope to a path of no return, and they just kind of resigned to that.
Yeah, you've got to, once you're diagnosed, as we talked about, you may have this is maybe in a 15-year process. So once you've done that, you're lost. A lot of the brain cells aren't working, and so the further you are in this, the more action you have to take. One of the things in the book title, Saving Your Brain, I made an acronym.
Okay.
Out of each word, saving your brain. So there's multiple things, and we don't have time to get into great detail, but let's go very briefly. Saving, S is sleep. Quality and quantity of sleep is very important. It protects it's neuroprotective, protects your brain, it cleans the beta out. A is autonomic balance. This has to do with our nervous system staying out of the fight-flight mode. So much of the things we have in our world today make people stressed, emotionally stressed, nutritionally stressed, lots of different things. V is vitamins, minerals, and antioxidants. There are specific documented studies that show many of these nutrients that are in the book that will protect you. So each one of these acronyms stands for something else. I is for immunity, inflammation, infection. So just chronic inflammation and low-grade infections can do this. One of the things we have in Florida, it's so damp here all the time, we have a lot of people have undetected mold infections, which are causing inflammation in the body all the time. N is for the neurohormones. So people that have problem with dementia, Alzheimer's, have very low hormone levels, much more than their peers. So that's something we can assess, and we can do that. For example, when your thyroid's not working right, that doubles your risk of Alzheimer's. Or conversely, when it is working right, it reduces it, cuts it by half. G is for the genetic variants. We want to look at those couple of genes, and then again, the key to that is we want to take the action steps to correct it. So that's saving. Y is for your lifestyle beliefs and thoughts, because they are going to dictate your actions, and making better food choices, exercising regularly, setting a consistent sleep schedule are all under our control. These are all things that we can do. So the biggest thing is trying to live in the present, letting go of the past, not being anxious about prospective future events. All these things help the brain work better. And the O and UR is for obesity, oxidative stress. The higher our body fat, the smaller our brain. The higher body fat, the more inflammation, okay? And the higher the body fat, the more oxidative stress. So this is a common theme in all the brain problems: ADHD, autism spectrum, TBI, traumatic brain injury, post-traumatic stress disorder, dementia, Alzheimer's, all have oxidative stress. So this is something that we can do by reducing our body fat, reducing oxidative stress. And then the U in UR is for a friendly environment. So we've got aluminum, mercury in our environment. We have pesticides like DDT, glyphosates, which is in the GMO food. These are like a neuroinflammatory cocktail. So there's different things that we can do by just getting pure water sources, air sources, choosing our foods a little better, try to get more organic foods. And then the N is for the neurohormones. We're on the R, sorry. Okay. I went backwards. R is for reading. Okay, so become a lifetime learning. Find something, a hobby or interest that entails reading. So definitely reading reduces our stress. If we don't have an interest or activity, so whatever it is you like, if you want to read about golf, read about tennis, read about whatever. Men who go home and sit on the couch are usually underneath the ground within 5 years. So we got to keep active. We got to keep something interest. So the last part, brain, is B is for blood flow. So a healthy blood flow is absolutely essential. When we do things like SPECT imaging, which Dr. Amen in Chicago is very famous for. He has over 15,000 with imaging, so I've taken his course. And all these common brain problems are demonstrated have reduced blood flow. So we have some specific therapies that will restore the blood flow of the brain. R is for repetitive head trauma, which is one of my biggest factors that guys like us, people who played football, soccer, rugby, hockey, for years and years and years are at higher risk. And so they need to start doing some of these things to protect the brain nutritionally with the antioxidants. Then in the A is for activity. We got to do exercise. Yoga. I like yoga and Tai Chi for the aging body. It's good. It keeps the circulation, keeps our strength going. But we want exercise increases our lean mass to our fat ratio, increases the blood flow to the brain. It helps our growth hormone, different chemicals that protect the brain. And then the I is for insulin sensitivity or resistance. So insulin resistance, which leads to type 2 diabetes, which means basically what that means is your blood sugars get higher because the insulin receptor inside your cell's not working, so it won't let the glucose get inside the cell. And that's what's happening with that. So that's something that responds very quickly to exercise, particularly weightlifting and cutting back on the refined sugars. And when you have insulin resistance, you produce more beta. This is this chemical in the brain that accumulates. But when you have insulin sensitivity, you get rid of it. So the last one in is for the neurotransmitters. So in the Alzheimer's brain, the dopamine, which is a major neurotransmitter in the front part of the brain, it's like the battery of your nervous system, okay? So when that becomes depleted, you're really not making energy in your brain, and you're not making electrical energy for your whole nervous system and body. And then the other thing is acetylcholine, and that's like your processing speed. You know, like we got computers back in the 80s, you know, and as you get more technology, it got slower and slower. So our brain is getting slower and slower. So we actually have technologies that can speed up the brain, charge the brain back up, and get it working better. But we've got to do, you know, like when we talk about once you're in that phase of diagnosis, you may have to do all these things, address all these things to save your brain.
So there's a lot of actionable things you can do.
Absolutely.
Perhaps you could give us an example of how you helped a specific patient in terms of when they came in, where they were, and some of the things you did, and how they progressed through the course of the treatment.
Well, I'll tell you, I'll share my worst patient, okay? To see if there's hope, okay? So this was a patient, Martha, who came in, and originally her husband brought me in. She was been a former patient of another associate. She was an author, very intelligent woman. I think she had a master's degree, very prim and proper, dressed. She spoke, great vocabulary. And she was diagnosed with Alzheimer's, but she had become she was nonverbal probably for 18 months. And her husband brought her in, and she was having incontinence issues. So we were treating her with acupuncture for that. And that got better. And so she had more control. She had more time, urgent when she had to go. Problem is when she had to go, felt like she went. So we were able to increase that time for her. And then I said, let's try this approach. And so we started doing different things with this, and we made some recommendations. And then we found, in a month or 6 weeks, that her husband, bless his heart, he's overwhelmed with trying, to do all these things. So that's one of the challenges is that some of these people, they need a support system. Some of these home therapies. So we started bringing her into therapy. And so in a period of, I would say, 6 to 8 weeks, she started to verbalize. So she's saying, some words, some phrases. We do different things. We have her counting, 1 through 20, 20 backwards, different words, the alphabet, the months. And, she's more ambulatory. She's able to go to card games. They had, for years at card games. So I don't know what her potential is. But I know if we would have got to her sooner, she'd be progressing. But at this point, we're giving her quality of life, and she's able to function. She's able to do more things than she was. So that's an extreme. So again, she's manageable. That her husband can, help her manage, and she can still go things. She can still come in the office. She still comes in the office a couple times a week. So we're still working with her, and we're continuing to use, introducing more technologies to her. So that's an extreme case. So we have other people who have had strokes, restoring, verbal communication. We have traumatic brain injuries, and who have balance problems, and again, memory problems, headaches. So it just depends on the condition. But that's, in the Alzheimer's, you can do so much more if you can catch it early.
Okay. So could you give us an example of a patient that you did catch fairly early, and the kinds of changes that they experienced?
Yeah, so we can get so for example, one of the technologies we use is canary speech. This is a very cool technology that is cutting edge, and they've done a study that's just been released on 2,000 patients, and they were able, with a one sentence, the voice recognition, determine an Alzheimer's diagnosis. So this is something that may be important in an early detection before other clinical symptoms. But in this cognitive test, so that we do with this, let's say their perfect score is 30, okay? So if you were an athlete and you scored, like you and I, if you got hit in the head with a rugby tackle, and we had a baseline and we couldn't score 22, we're not going to be allowed back in the game. That's how we use this now in sports.
Okay.
But it's like we had an individual, they scored 18, okay, when they came in. So just by developing a strategy, so one of the problems with sleep, okay, not sleeping, getting to sleep in there, because what happens, we go through 5 cycles of sleep in about 90-minute increments. And that last one, usually in the 6 to 7.5 hours, is when we get into deep delta. And that's when we clean the brain. So when we don't get that, lots of times in the aging, we're not getting that good quality sleep. So just by correcting that, starting some exercise, using a couple of technologies at home that we have for patients to increase, we have a head harness that'll increase the circulation in the brain. And then we have a visor and like earphones that train the brain so we can actually increase the speed of the brain. So doing these things and doing some nutraceutical support, this individual got back to a score of 23. So again, we're seeing improved cognitive function, improved quality of life, improved memory, recollection, and speed.
Okay. So, this is, it's not like one little strategy will make all these changes. It's based on the individual, how soon you come in and start doing things, and then finding protocols that fit your specific situations. Yeah,
so one of the things is early detection. If you have a family history or different thing, or just getting testing. So, I mean, a lot of this testing that you can do on your genetics is very inexpensive. You're talking, like $100, $150, So if you have this ApoE4, and 40 to 50% of the people who develop Alzheimer's have this genetic variant because of the inefficiency. Well, if you took niacin, but you got on a regular exercise program, made sure your blood sugars, then that gene is not going to negatively express. Your body can compensate for that.
Okay. So, Dr. Miller, what would be your general advice to people that are looking for help in preventing and or reversing dementia or Alzheimer's for themselves or for a loved one? What's the biggest takeaway or recommendation you can give them?
Well, the biggest thing is read the book, and then look at that different things. One of the things we have at the office is we offer telemedicine, so we have offices in Kansas City and in Tampa. But people can come in and we have test kits. We can do Skype. We can communicate with them, and we can get a baseline assessment. So first, let's see if there's a problem. If they're involved in it, let's see what we can do to turn it around. So one of the things, just to get a good screen, is this Brainspan is a nice test, online test, to kind of get an idea where you're at. And then I'll also pick up if you've got a lot of nutritional deficiencies in the brain as well. So it's a nice, fairly inexpensive test to get the baseline on yourself. So
although you've got locations in Florida and Kansas City, if someone that didn't live in those areas wanted to work with you, you have the capacity to do so. Is that correct?
Absolutely. Yes, we can come in. They fill out a form. We'll develop a telemedicine relationship with them, and talk to them and get what kind of testing. If we need to do any specific testing, we can have things shipped to them. We have a lot of home therapies. One of the things we're developing is this is an effective home therapy. So we have therapies to increase the circulation of the brain, a head harness, which was researched at VA hospital in Boston, and again showed increased circulation, increased reduction of symptomatology, and improved cognitive testing. We have something that's called Brain Tap, which is an audio-visual entrainment. I think you're familiar with Brain Tap, aren't you, Phil? And that can be done. So one of the things we do with a patient is we'll do an EEG assessment to see how their brain is working. You know, what's the power of the brain, what's the speed of the brain, what's the coordination of the brain, and then we can use like the Brain Tap technology to help reinforce those weaknesses. And then again, we're looking at, you know, what is this person's, do they have, what nutritional deficiencies do they have? What can we do to support the brain? So there's many, in the book that we talk about several different nutrients. For example, in China, there's something called club moss, which is another name for superzine A. That is the number one prescriptive drug in China for Alzheimer's, but it's a natural product. So that product is available here, so a specific dosing. And it combats the formation or the disposal of a beta out of the brain in 5 different pathways. So what we find in a lot of the nutraceuticals and also in our treatment of acupuncture is that it supports multiple pathways. So one of the things we're doing with our patients is we've developed a microcurrent treatment methodology that the person can be trained to treat these acupuncture points with a microcurrent. And it will actually help with the circulation of the brain, help with the glucose metabolism, and help with reducing inflammation in the brain.
Okay. So, Dr. If people wanted to get more information about health restoration or to contact you, where should they go?
Well, just go to the website, www.drkelly Dr. Kelly Miller, or you can get through www.healthrestoration.solutions. Either one of them will take you to our website. And we have information there they can fill out, just an intake form. There's a question. What are they, what information they're seeking? So we want to be a resource of information for people. Where's the starting point? Where can they look? Where can they go? Is there another provider near them that could assist them? And the other thing is we have our different office numbers in Missouri, 816-210-6913, so that's 816-210-6913, and in Florida, 813-985-5190. So if they call, again, and tell us what they need, and we'll try to do that. So on the website, there's abundance of information about all kinds of things. Testing. We have a brain and body products section, so they can get some of these nutrients. But it's best if they get some direction. So we know what would be best for that individual, because different people need different things.
Right. And what I found on the web, there's a lot of videos, very informative, informational videos that can help educate people a little bit about what to expect and what to look for. And I think that's very, very helpful to invest that amount of time to get the information you need so you feel comfortable. And, of course, there's the book, Saving Your Brain, Causes, Prevention, and Reversal of Dementia, Alzheimer's, which is available on Amazon and Kindle. So, again, suggest that they pick a copy of that up, because it does contain a lot of great information. And the more aware you are, the more informed you are, the better you can help whatever practitioner you work with to get the best outcomes. So,
well, thank you so much for having me. It's been awesome, and I hope I encourage people to read the book. I think it'll be really helpful for them. At least give them a way to get started.
And I thank you so much for that. And again, the takeaway for me is that act now, start doing things that you can control, and that there are options out there if things, digress a little bit. So don't give up. There are options, and there is hope. So thank you so much for sharing the information and providing the great services that you do. And you have a great day, Dr. Miller.
Thank you, Phil.
You've been listening to Never Too Late for Fitness Radio, hosted by Phil Ferris. To learn more about the guests or resources on our show today, or to listen to past episodes, go to nevertoolateforfitness.com.